Hi, everyone. Thank you for joining the Family Wellness Program and YWCA Wellness Wednesdays, where we'll be talking about sickle cell. We'll be demystifying sickle cell. I am really excited to have Miss Eboni Davis-Townsend here with us today. She is a family nurse practitioner, and she was born and raised in Detroit, Michigan. She completed her academic training at the University of Detroit Mercy, from which she obtained her bachelor's and master's of science in nursing, as well as her doctorate of nursing practice degree. Ms. Davis-Townsend has dedicated her entire nursing career to delivering holistic care to patients within her community. She strives to be the voice for the voiceless, as well as improve patient access to healthcare. She aims to do this by helping patients to overcome their obstacles that impede them from receiving quality care. Ms. Eboni is the founder of Essence of Life Health, LLC. Thank you, Ms. Davis, for being here. I really appreciate you for joining us today. We're just going to dive right into the question. So if you don't mind telling me, what exactly is sickle cell?
Okay, so sickle cell disease is an inherited blood disorder. And so what happens is both parents have to have what we call a mutation, a gene mutation in their blood. And the two parents together pass that trait down to their child. And that's what kind of encompasses the disease itself. So it's an inherited genetic blood disorder where there's a gene mutation that causes the blood, like the regular round red blood cells, to sickle and become like misshapen and distorted. Okay. So there was a gene mutation that was passed down to the person who has sickle cell disease from both parents that they have.
So then with it being a genetic disease, how is it usually diagnosed?
So a gold standard would be newborn screening. But the newborn screening, because newborn screening was mandated back in like 1986, right? So up until that point, it was kind of like trying to figure out what was going on with the child. So we have newborn screening that does capture a bulk of the genotypes that sickle cell has, but we also have what we call hemoglobin electrophoresis, hemoglobinopathy evaluation, and it's just taken in peripheral blood smears where it just takes a closer look at the blood cells and the shape of them, how big they are, how small they are. So it's those are like the top four. And then if for whatever reason the genotype or the sickle cell is not being picked up on our normal everyday standard type of diagnosing, sometimes if a child goes to the doctor, the doctor or nurse practitioner would see like an abnormality in like their hemoglobin level, like it's really low for no reason whatsoever, or like their reticulocyte count, which is like the baby red blood cells, is really high and they don't have a diagnosis. So it's usually that something is going on with that panel that makes them dive a little bit further to see what's going on with the patient. So those are a couple of the ways that it can be.
So then if you don't mind me asking, somebody that has been affected by sickle cell, what are some of the challenges that someone might face with this disease?
It can be a plethora, right? So sickle cell, I just want to put a caveat out there that when we think about sickle cell, anywhere the blood flows, there can be a problem, right? So the most sought after problem is pain, but it's so much deeper than pain because the sickle cells can affect all of the body. So one of the top things I think would be an issue or challenges is not having a provider that's knowledgeable about how sickle cell affects the entire body, right? The other thing would be transitioning from pediatric care to adult care. That is a huge culture shock. The other thing would be like the stigma that they face, care coordination problems. I could probably go on for days about the challenges that they face. One of the things I would say, if we're talking about physical, but we may cover that a little bit later, but there's a plethora of challenges that are like physical, psychosocial, and then knowledge-based rooted. So there's a plethora.
Are there different types of sickle cell disease?
Yes. So one thing I always highlight is sometimes people use sickle cell disease and sickle cell anemia interchangeably, but sickle cell anemia is actually a specific genotype of sickle cell disease. So it's hemoglobin SS. So there are several different types of sickle cell, but hemoglobin SS is the most common. Then you have sickle cell SC, you have beta plus thalassemia, beta zero thalassemia, a genotype SD, and SE. Those are the most common, but there's
Okay.
more.
Okay.
So I just kind of highlight the most common because a lot of the other ones you will rarely see. But again, as I alluded to before, you may not even be able to diagnose that until you dive deeper into like why this person's labs is completely out of whack.
If it's not diagnosed with a newborn screening, would it just be your regular primary care doctor that does the testing for you?
Yeah, normally it's going to be whoever that person's mainstay provider is. So if
Okay.
they have not been diagnosed with sickle cell, they won't have a hematologist as
Okay.
of yet, right?
Okay.
So if they have a primary care doctor and they're ordering like just, routine labs and they see something is off with the blood work, then that's when the referral goes to the hematologist. But the
Okay.
primary care provider may be the one to order the necessary labs to help the hematologist make that
Okay.
diagnosis.
Okay.
There are programs out where people can be tested for sickle cell trait, or
Okay.
if there's a history of sickle cell trait in their family, they can ask their primary care doctor to obtain labs that will help them diagnose sickle cell trait. And that's important because knowing if you have sickle cell trait will make you more cognizant of who you have a child with. And you want to ask that question, hey, do you have sickle cell trait? Does sickle cell trait run in your family? That way you're kind of educated beforehand and knowing the risk that you're walking into.
Absolutely.
In terms of having a child with sickle cell disease.
So I know that we said that body is affected in tons of ways because there's blood flowing through all of it. But what are some other health issues that might be related to sickle cell disease?
So there again, like you said, there's a plethora because wherever blood flows, we have to worry about complications. But stroke is number one. Like the risk for stroke in a sickle cell patient is very high. And that's secondary to, remember, I told you the cells are misshapen. And so they often clump together. And when they clump together, they cause ischemia. And so that cuts off oxygen to different organs in different parts of the body. And so brain is a commonly affected area for this to occur. So the risk for stroke is very high in a sickle cell patient. But that's why at the pediatric level, we do a lot of screening and imaging of the head to see if we can identify if that particular person is at risk for a stroke. We also we have to worry about cardiac issues. Again, those blockages can cause like the blood to not flow through the heart effectively and kind of backs up into the lungs. It causes like what we call pulmonary hypertension. You can have eye issues like what we call is like retinopathy of the eye, which is like it may manifest as a child or as an adult, like blurred vision or vision loss. It can cause renal issues like an occlusion, like vasal occlusion in the kidneys. So again, every body system that you can think of, it can be a potential problem.
Why are some people more prone to having sickle cell problems than others?
So it's a holistic picture, right? There's a lot of lack of education. So not even just from the providers that are caring for patients with sickle cell, but sometimes from the caregivers or from the patients themselves. They sometimes don't know that maybe if you make a different diet change, you can decrease your likelihood of having like a vaso-occlusive crisis or what we call a pain episode. Depending on where you live, right? Like I was explaining to you, we migrated from Detroit. And I knew for certain in Detroit, with the weather fluctuating and being bitterly cold during a certain time of the year, actually from October to March, my daughter was in the hospital all the time for pain crises. So it's kind of, you have to learn what your triggers are that will exacerbate your sickle cell. And once you identify those triggers, and everybody's going to be different because it doesn't affect one person the same. But once you identify what your triggers are and you try to avoid them, you can basically optimize how well you live with sickle cell. And so that's kind of what the differences are that, that you have to kind of identify. Like I may know that if I'm getting ready to take a test, because stressors can ignite a flare in sickle cell. If I'm getting ready to take a test and I'm super stressed out about it, I know that I need to do things that help reduce my stress so it doesn't lead into a crisis. So it's all about the individual learning what their specific triggers are and how to live better and healthier lifestyles, things to avoid, like as far as foods and things for inflammation. It's a whole caveat, but it's all starting with either the parent identifying what the triggers are first and then teaching them as that child gets older, or sometimes the caregiver doesn't know, so the adult that's living with sickle cell has to do the work and find out for themselves. So it kind of just fluctuates.
And can sickle cell be cured? Is this a disease that can be cured?
So There are a lot of medical advances right now, but there is no universal cure.
Okay.
So the one way to potentially cure sickle cell in someone is a bone marrow transplant. And the reason I say it's not a universal cure is because even with the bone marrow transplant, it may not take. So there's not a surefire way that the transplant will cure the sickle cell. And then it's not applicable to everyone that has a bone marrow transplant. So there's what a bone marrow transplant is basically you wipe out all of the bad cells or all of the sickle cells from the person, and then they have their cells donated from someone that's healthy.
Okay.
But it's two different trajectories that can take. It can either take, and then that person starts producing normal cells and they live a sickle cell free life, or their body is like, what is this? What's happening? And they reject those donor cells. So it can be a little tricky.
And then what are some of the treatment options that people go through when it comes to having sickle cell?
So we do have a couple of medications that can help improve the quality of life of those living with sickle cell. So hydroxyurea is the mainstay, the gold standard, the baby that has been out probably the not probably it has been out the longest. And this medication is used to increase fetal hemoglobin in the patient, which tends to be the normal red blood cells. And so if it increases the amount of normal red blood cells in that patient, it helps to reduce the amount of sickling that they have.
Okay.
And then we have a medication called Oxbryta that was newly came out probably, I believe in 2019, don't quote me, 2019, 2020. And it's utilized to help maintain a healthy hemoglobin level.
Okay.
And so it kind of prevents people with living with sickle cell having the ability to be transfusion dependent, because even when you're getting a lot of blood transfusions because of the anemia, that comes with some side effects that are also sometimes worse than actually having the sickle cell. And then we have Adactio, which came out recently, and what happens is that's an infusion medication that targets a certain protein that sickles the blood. So if we could reduce the amount of protein that's in the body, we can reduce the sickling. And then we have Endari, which is a supplement, basically. It's a glutamine supplement. And that kind of helps reduce the oxidative stress. So all these medications in some way or mechanism helps to decrease the amount of sickling in the body, thus reducing the breakdown of the red blood cells, which causes the anemia, and it reduces the clumping of the cells together, which causes the pain and the ischemia throughout the body.
Wow, and I'm really happy to hear about all of these medical advances. These are things that our community should know, and that we want them to know so that they can take better care of themselves.
And I will say it's going to be, I'm sorry, just a real caveat. It's going to be independent, in terms of what works for one person, right? So if they're interested in these things, I just want to be abundantly clear that they should check with their hematologist who is caring for them to see if they qualify for these things. Because there's not one thing that's going to work for everyone. And so it's individually based, and the provider should be the one making the decisions, but feel free to put it on their table like, hey, I heard about blah, 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 you know what I mean? So, but always make those type of decisions with the primary person taking care of their disease process.
I wanted to ask, why is it important for a child with sickle cell disease to be seen by a pediatric hematologist?
So it's pivotal because if you think about a hematologist, they study blood disorders. So they're much more versed in how this blood disorder manifests, how as the person gets older, the things that the parents should look out for, different signs and symptoms to educate about, what the expected complications may be depending on that particular, child, and things of that nature. I would also say it's equally important to have a pediatrician, because what I know in our population, in the sickle cell population, because the hematologist is the more knowledgeable provider, we kind of use that person as the one-stop shop because they know everything about sickle cell. But a primary care provider is also just as important, because you want someone that can help you coordinate your care between maybe the hematologist and maybe an eye doctor that you need because of the retinopathy, or a kidney doctor if you're having kidney issues. So the primary care provider can help kind of be a medical home and coordinate all that care for you as well.
Okay. And then I also wanted to ask, what are some disparities that people face when it comes to having sickle cell disease?
So with healthcare disparities, especially with sickle cell disease, there are certain things that trigger my brain to think. So there's always an under treatment of the type of pain that they're having.
Okay.
And it's secondary because the disparity in knowledge, right? So
Okay.
if you're not a hematologist, like we discussed, sickle cell isn't something that's formally taught in the school enough for you to be well versed. So a lot of times people are dealing with providers that don't know how to effectively manage pain. They don't know that the type of care that you take for someone with sickle cell is different than someone that's coming into your facility with like a car accident pain or something like that, like a back pain or something.
Mhm.
So often things are undertreated because they're not getting the amount of medication
Mhm.
that they can handle and that they can tolerate because the providers are scared to give them those doses. So
Okay.
that's a healthcare disparity. There's also a horrible stigma attached with patients living with sickle cell disease, I think secondary to the type of medication they require to manage their disease. So one thing I always say is that pain medication to manage a sickle cell pain crisis is no different than needing insulin to manage a diabetic, right?
Mhm.
So once providers can remove the stigma, they like increase the access to healthcare that the sickle cell patient should have. Other disparities, I would say, would be just access to primary care because again, there's not a ton of knowledgeable providers, so they may even be intimidated to take
Mhm.
on a patient with sickle cell disease. So that kind of reduces how many providers they have access to coordinate their care.
What most common ethnic group is affected by sickle cell disease?
So most commonly is going to be African Americans, but it is not the only. So we are the most highly affected, but
Mhm.
you have a high occurrence, especially in Florida, of Hispanic population. We also have like Middle Eastern. And I want a take home point to be that they don't have to look like me and you to have sickle
Mhm.
cell. I
Mhm.
know blonde hair, blue eyed people with sickle cell. So that would be something that I would probably not probably, I advocate for that it doesn't have one tone of skin.
Mhm.
It can very well affect a plethora of people, but we are the most commonly affected because of the origin of sickle cell, but we are definitely not the only.
Thank
So,
you.
mhm.
Ms. Davis, I'd like to thank you again for joining us today to
My pleasure.
provide education to our community.
It's
If
my
there
pleasure.
if there's any questions or people want to reach out to you to maybe get more education, and we also add that to the comments, you guys, so that you guys have that information as well. Thank you. I hope that
Thank
you have a
you.
wonderful day.
You as well. Take care.